Okay, Zambia is size of Texas, huge country, but population is now close to 40 million. From east to west is 52 minutes time zone. So when the sun rises in the east, it's still dark on the west. Okay, these are the hospitals which we are serving these days. All the lines where we are flying today. And right now, one team is all the way to your left to Mongu. Its orthopedic team is left yesterday for Mongu, and they are operating there. We are serving currently 14 hospitals around the country, and overcrowded of the capacity in Lusaka is huge. So honestly, before I retired from university, we had more than 120 children that were on the waiting list for surgery, and we operate maybe two to three child a week. When we go to rural areas, we operate anything between 10 and 20, 22, 23 patients for the duration of our visit, which is 2 to 3 days during the visit. There are orthopedic specialists, but located basically in just 3 sectors, and patients really don't have opportunity to get the service that they need, particularly in the wake of increased road traffic accidents, because recently Zambia allowed motorbikes to be used as a taxi service, like in Uganda they call it boda boda, or for delivery, and those motorbikers, they have no respect for the traffic rules, and therefore they knocked off. Most of them, they don't even wear the helmets, and we have increased number of fractures due to these accidents. So the goal of FlySpec is to bring orthopedic and plastic surgery services to rural population. So usually people travel a couple of hours. Sometimes it depends on the area where we visit. If it depends on the time of the year. They even travel for 1 day to reach this place where we are visiting. And you can imagine how long it would take for these people to come to Lusaka. The other advantage of our visit there is we are basically visiting them at their homes or very close to their home. So relatives come and visit patients from home at no expenses, versus relatives traveling to Lusaka and staying there, feeding themselves or paying for accommodation. So it is very convenient for the patient, and with the hospitals that are helping and admitting them, it's also they're giving a service to the community. We also teach local doctors basic management of fractures, and we also come with the residents when we fly to these places, because we take orthopedic residents with us, and they actually are gaining more exposure to surgery versus what they have opportunity in Lusaka. They technically operate once a week elective cases, and then once a week, 6 times a month, let's put it that way, they do trauma service call. when they are home. So they really get much more exposure to surgery when they travel. Same is with plastic surgery trainees or the general surgery trainees that are joining me on the trip. They also get bigger exposure to practice of surgery. You heard of Professor Jelis. He started this program in 1982. He had a small aeroplane and he was a private pilot. And he also realized those days, and hardly anything changed, that the country is so big, and no matter how many doctors we produce, there will always be a need for specialist services in the rural areas. So he started it in 1982. In 1994, he founded Lusaka Orthopedic Research and Education Trust, LORET. This is the year when I joined, and with the idea to train orthopedic surgeons, and that's also a year when our orthopedic officially orthopedic training started locally. Before, doctors were going abroad for training, and now we produce quite a large number of orthopedic surgeons locally, and some of them are extremely competent and very good orthopedic surgeons. Few of them are part of, you will see it later on, the number of doctors that are regularly participating, but residents are actually queuing to join the trips, which there are a couple of hospitals, 2 hospitals where the trips are going every month, and there are few hospitals that orthopedic surgeons are visiting either 3 times or 6 times a year. These are the doctors that are flying. We have, apart from it, it was only plastic surgeon and the pilot. All the other doctors are regularly participating in our trips, and they are really doing a great job when they do. I was just really looking at the latest last 3 years audit, and I will present it later on to you. But these are all consultant surgeons. These are the hospitals that we are serving. I think I put all of them, and so you can see the scope. Only one province is not served because of some political personal issues, but hopefully we will return to that province very soon. This is landing at Chitokoloki across the Zambezi River. This is the village, typical village that is in the western province or part of a southern province, where Kafue and Zambezi River are going through. And the people are really happy when we come because they know that they will get service. And almost 60 to 70% of our patients are children, although now due to trauma, more and more adult patients are seeking our service. This is San Italian Orthopedic Hospital. Okay, this is our annual budget. This is how much we are spending on our aeroplane. We are still waiting for our engine to come from South Africa. It cost us about $100,000 on overhaul. We are still looking for $30,000 to pay. The engine is not yet ready anyway, so hopefully it will be ready before month end. But This is what we spend every year just on flying and how much it costs us. These are our aeroplanes. One with the blue one on top is now without engine. Cessna 182 is still flying. I flew just before going on short holiday. And the one at the bottom, May 26, ended up in the bush because the engine failed in flight. Oil came out, and okay, 3 of us, we walked away, so it was a good landing. After that, we managed to get Cessna 182. We already had Cessna 206 at that time. Okay, logistical problems. Relatively older aircraft, but now with the new parts and new engine. Avgas is only available in 3 places in Zambia, and Lusaka, Livingstone, and Ndola. But luckily, now both our aircrafts have tic tacs, and we can go to all the other places that are on the map and come back with the full tanks. If we are to visit 2 hospitals, then we have a farm on the right hand side, coming from Lake Tanganyika down, where we can refuel, or we can go right near the Pentacle to Ndola. On the way back, we can refuel. So it is easier. Before, when we had the smaller airplane, that Beech 23, we always had to ship fuel, a couple of drums to our destination, so we would refuel after doing surgery and go back home. We need those remaining $30,000 to pay for the engine, plus we are still all of this into funding the operational activities. Over 8 years, we received almost 1 million euros from them those days. From that one, we bought through Wings of Hope Cessna 206 in 2007, and but the Netherlands embassy closed the embassy in Lusaka, and we since those days we are basically operating from head to mouth. But there are certain churches that are helping us: Rotary Club of Lusaka, Masonic Charity Funds, Wild Geese Society of Zambia, and many individuals. There are more. Smile Train Research International, Alma Mage Cemetery Restoration Trust, and Dr. Paul Austin is brother to that big church, man Austin mega church somewhere in Texas. Dr. Sylvia Paraccio was a student when she was in Zambia in 2006. Now she is a plastic surgeon in Ohio, and she helped us over the years with over about $35,000 since 2019. And of course, Wings of Hope. And in 2023, number even more increased. I've done 394 surgeries, and I've seen 1,035 patients, and orthopedic surgeons have operated 978 patients, and I've seen 3,431 patients. So for this year, we are still waiting for the statistics, but over the years, we have operated more than 25,000 patients and have seen over 90,000 patients.